The UN is warning famine is looming in Gaza as humanitarian groups, as we just heard from Tom, struggle to deliver that aid, including much needed medical supplies. We want to bring in Dr. David Hasan, a neurosurgery professor at Duke University who worked in Gaza last month. We're going to ask him a few questions here. Doctor, thank you so much for joining us. First off, what was it like working on the front lines when you were there?
Thank you, Stephanie. It was very, first of all, the conditions in Gaza at this point are very, very dire in multiple levels, including famine. The World Food Bank announced that level 5, which is the highest level of famine, are affecting about 400,000 people. There's also about 1 million of people are level 4, which is severe. So there is a lot of problems. It was terrible conditions for even the healthcare providers who are traveled from around the world to help. And when I arrived at Rafah, there was probably miles and miles of trucks on the 4 sides of the highways that are waiting to cross Rafah. And the problem, the bottleneck, as we heard just a few seconds ago, the crossing, the agencies that kind of process that. Before the war, there were about 500 trucks crossing every day. At this point, we are lucky to have 200 trucks crossing. And because of the military arrangement, northern Gaza, where have about 400,000 people are trapped, they're not getting anything at all. No water, no food, no medical supplies. People are eating grass, sometimes drinking from toilet. People are eating dead animals because of the famine, the severe conditions. This is just part of the problem. And then on the side of the healthcare, there are no supplies at all, minimal at best. We were doing some surgeries without anesthetics, amputating legs without any pain medications or anesthetics. C-sections are done without any anesthetics, even painkillers after that. Antibiotics, lack of antibiotics, we do a good surgery, but there's nothing to cover after, and these surgical wounds are infected and lead to death. We have maggots growing out of the wounds. The safety is lacking. We have several physicians who were killed where we're there, not from our group, but from people working within the hospitals. There's no safety for the medics to transfer patients from different areas. Some of them were killed. We heard about the 60-year-old girl that got trapped in the car for hours, and the medics went in to get her. And then after a few days, they found that both medics and the baby were killed. So, so the conditions are very, very dire.
It sounds like just an incredibly awful situation. What motivated you to go there and help, and how did you handle that situation, seeing these just awful scenes?
You know, I'm a human being. I'm a physician. We are all, when we see these scenes on social media and mainstream media, your heart goes out. So I felt I was flustered, and nothing has been done. Especially, these people are innocent, Stephanie. They have nothing to do with Hamas. These innocent children, nothing, and being trapped. And both sides are hurt. I mean, the Israeli innocent children, women, and elderly were killed. There's no justification for that. So the fact that I'm a human being and a physician, I felt I'm compelled to go there. It was horrible. Like, you know, during the night, we're here bombing all the time. It was very, very close. One of the hospitals I worked in is the Nasser, which, as you know, already closed and sieged. So it was there's a fear of being hurt or bombs accidentally falling within the premise of the hospital. And I mean, you could see from these scenes, Stephanie, these hospitals became a refuge camp, and this hospital has 50,000 people in it, just crammed in it, because they relatively think it's their home and safe, and they live in it, and they don't even eat and cook, even in the bathrooms, because of that. The lack of food, the lack of water. Yes.
Well, Dr. Hasan, we want to thank you for your service, for going there and providing aid and helping the people there. So many challenges that the people there are facing, and also the medical workers as well. We want to thank you for your time and for sharing your experience with us. Really appreciate that.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.